So today is my day 5 of post-cervical cerclage, and I'm already at home. But after the procedure, I was supposed to be discharged, but the doctors, the consultants in that hospital decided to keep me for admission, at least for one night stay in the hospital, because they are monitoring if I will have bleeding after the procedure. So the next day, before I was discharged, I was checked again. They checked again the heartbeat of the baby, which is fine. There is an heartbeat, and actually that is the routine before they will discharge the patient. And after that, on my second day, I was on bed rest whole day, and I was not able to walk around even. So I stayed on the bed, and but only with bathroom privilege. On the third day, it is same like that. um, Bed rest again, and then on the fourth day I'm a little bit comfortable going around and doing my normal activities at home. But I'm a little bit cautious because of my situation. Uh, why I was referred at 14 weeks for cervical cerclage. Actually, I was referred for cervical cerclage because of cervical assessment. I suffered from infertility for 5 years, so we are having hard time in getting pregnant. So at first year of our marriage, we tried to make it a normal conception and timing. So usually nagta-timing ako. So I downloaded applications, and also I'm counting from my period and kung kailan ako magiging fertile. After 1 year, I found out that I had multiple myoma. It was only three pieces lang nung nagpa-ultrasound ako sa Pilipinas, and I found out na tatlo. It was intramural myoma, in which sabi naman ng doctor, it will not interfere the normal conception, and it will not affect because that time it was small only. And then so the doctor in the Philippines offer me medication in which I can use para matunaw yung myoma, but it will sinabi naman niya yung effect in which na it can cause mag-elevate ang BP ko. So because I just ni-receive ko siya, but after a month or two, nung bumalik na ako dito sa Oman, tumaas na yung BP ko. So I cannot control it anymore. I stopped the medication, but even stopping the medication, I still suffer from high BP. So nag-medication ako for BP. And then after that, we decided to go for treatment after that year. So infertility treatment that time under the Ministry of Health in Oman is free, but I tried to have treatment that time for almost a year, but I suffered from depression kasi it's like nagkakaroon na ako ng frustrations, bakit hindi ako nabubuntis, what's wrong, even though they are telling that my egg cells are big, and even my husband's sperm analysis are normal, but still hindi ako mabuntis-buntis. And then after that, we decided to stop the treatment. Then after sometimes naisip ulit namin na mag-seek ng consultation, and pumunta na kami sa private clinic. And that time they offer us IUI or intrauterine insemination, and which nag-pursue naman kami kasi we really want to get pregnant that time. So we tried for twice siya, and it was failed. So, it's very difficult for us, like, especially me, parang ang sakit. And then, that's the story of our journey. And then, after that last attempt nung 2021, I decided to stop the treatment kasi nagsasuffer na ako sa depression, and madali na ako ma-irritate, madali ako mainis kahit sa work ko. It's affecting how I deal with other people. So we decided to stop. So this early 2022, my husband decided to continue the treatment. Pero kasi ako, it's like parang ayoko na kasi magre-reach siya ng IVF na. So kinukulit niya ako to go back to the infertility clinic and to do IVF, or what you call in vitro fertilization, and in which it's very expensive siya, na kapag dito mo pinagawa sa Oman, the cost of the in vitro fertilization is around 3,000 to 5,000 Omani Riyal. Tapos you don't know if kakapit ba yung embryo na ipapasok nila sa'yo, or magiging or hindi. So, or magiging successful. Kaya parang nagkaroon ako ng doubt na ituloy yung treatment kung mag-IVF. But after some times, my husband got my approval kasi parang sinasabi nga niya, if you really want to have child, it is better at this time because of my age. I'm going 37 that time, and then parang ayoko ng, sabi nga niya, kung itutuloy man, it is better na ituloy na, gawin na, kasi mag-risk na kami kasi nagkakaedad na daw ako. So, pumayag ako, and umattend na nga rin ako ng mga seminars about what are the process of the in vitro fertilization. But after a month na umattend ako, or after mga 3 weeks, na-find out namin na pregnant ako. So, nung nalaman kong pregnant ako, I was referred to this hospital na yung big, parang secondary hospital dito sa pinagtatrabahuan ko, because of the infertility and some una sa lahat, I have infertility, and then I'm on treatment for hypertension, and sabi nga, old primey. So, I was referred for cervical assessment, and the doctor gave me appointment on my 14 weeks. So, on the day of my appointment, so nagpunta kami, and then I did not expect that they will do a cervical cerclage on the next day. So, nagulat ako kasi parang yung sa assessment nila, maikli yung cervical line, yung cervix ko, and the cervical lining is very thin also. So, yun nga, ginawa nila yung cervical cerclage for me, and I was advised to keep on bed rest for 1 month. So, I was on sick leave for 1 month, and another appointment after 1 month para i-assess kung kumusta si baby and kumusta yung placenta ko. And yun nga, kasi kung ito yung cervix ko, nandyan na yung placenta. So I'm low-lying placenta, and they are afraid if I will not do a cervical cerclage, I might deliver earlier and magkukos siya ng abortion, in which baka hindi kayanin ni baby pag mas early ang delivery ko. So, they're preventing na yung abortion, and magkaroon ako ng premature labor. So what to do, it's the blessing. Naniniwala pa rin ako na God has given this baby to me and He will always protect us from anything. So, yun nga.
Nagbigay sila ng food, di naman pwede. Nakatali na yung hair ko. Tatanggalin ko na lang eyeglasses ko. Wala na akong retainer. And tinanggal ko na ang sing-sing ko. Wala rin nail polish. So, I finished another set of ultrasound. They just checked the routine ultrasound. They just checked the heartbeat of the baby and if my liquor is enough. So they told me to just wait and keep on NPO. If I don't know if they are sure if they will do me cerclage or not. So I'll just wait here in the park. So the nurse just checked my BP and it's becoming high. Na-anxious yata ako. I'm on hypertensive medication, methyl dopa 250 mg DID, because before I got pregnant, I'm already on maintenance. So they just shifted into the medication which is safe for the pregnancy, which is the methyl dopa. I started with methyl dopa 250 BID, but it is not enough, so they increased it to methyl dopa 250 one tablet TID, or 3 times a day. So I'm already on the gown. They asked me to put on gown, so they will put me my cannula. They called me again for another. They want to confirm if my myomas were not going to interfere the cerclage. So they did by vaginal speculum, but I was not able to tolerate the vaginal speculum. Ang sakit siya. And they did again trans-V ultrasound. So they told me that it is safe to do the cerclage because the myomas are away from my cervix. Ganito pala maging pasyente. Ang hirap. Pati pag sa cannula. So I asked them to change my IV cannula because it's really painful. Now it's better than before. So they started me already IV fluids because I'm on NPO since 11 o'clock. Ha? Pause off. Hilo pa ako. Ang haggard ko man. Bawal igalaw ang ulo.